Hello guys, welcome back to the channel. In today's video, I'm going to be discussing with you about choosing where to give birth. I'm going to do a three-part series. This is the first one, discussing with you about different options for your delivery. The first one being a home birth, second one being a birth center, and a third one being the delivery suite. So in this video, I'm just going to talk about giving birth at home, which is a home birth. So for home birth, you need to be eligible for home birth. So not everybody can have a labor or birth their child at home. Hi, my name is Gifty. I'm a midwife based in the UK, and I do videos to give information to women or men out there who may not be otherwise able to get some information that I share here. So please take this as information purposes. So if you do need any more explanation on anything I've said and you want to know more, either you can leave a comment below or you can speak to your health professional who will be able to guide you more on your personal journey and your circumstances. So this is just for information purposes. So right, let's get back into the video. So for home birth, not everybody, like I said, will be able to give birth at home. So in order for you to be able to birth at home, you need to be, first of all, be very, very low risk. So you mustn't have any health conditions that may require you to need any interventions, any doctor's involvements during your labor or delivery. You must be low risk to a point where you do not have any concerns regarding your baby either. So there shouldn't be any issues with either diabetes, where you need insulin, or where it needs more interventions from doctors following the birth of the baby. You need to be really low risk, and they're not concerns with your blood pressure. Basically, you need to be really low risk. It doesn't matter if it's your first baby or your second baby or your third baby. It doesn't matter. As long as you're low risk, it can be individualized, and it will be, your risk assessment will be done to make sure that you are suitable for it. So number one, you have to be suitable. You have to be checked to make sure everything is okay with you and your baby. Now, there are pros and there are cons of having your baby at home. I will start with a few of the pros. So the first one is that you'll be in your own environment, so you're more likely to be more relaxed, be able to then let your hormones flow naturally and get you progressing quite nice and beautifully. So it'll be nice for you to be in your own environment. You can have people that you want there to be with you. You can have all the things that you require. You know where your bathroom is. You feel comfortable going to use your bathroom because it's yours. You will have your food, your snacks, fluids, everything will be around you. So you'll be more likely to, stay calm, stay relaxed, and just stay more confident in yourself and give your body the chance to do what it needs to do without worrying and panicking about anything about where your environments are. The other benefit is that you will also have a midwife who will be looking after you during your labor. So your midwife will be with you the whole time. They're not going to need to leave to go to another room, to go and be with anybody else, to be called out. So when your midwife comes to you and they assess you and they say, yes, you're in labor, they're going to stay with you. That will be it. They will be staying with you right up until you've delivered and everything is done and, finished and cleared up. The other benefit is that they will call a second midwife once your labor is progressing well and they know you're about to deliver. They will call a second midwife to be with you during the birth. So that means you will have one midwife for the labor and two for the birth. So there's always going to be two midwives to deliver your baby. Okay, the other good thing is that you can have all the pain relief that you will need as well. So they will bring with them the gas and air. You can rent a TENS machine. You can also have a water birth at home. So you can rent a pool or you can buy one. They're really inexpensive, so you can buy one if you plan to use it again for a second delivery or for a second birth or something like this. So it's always beneficial to invest in one if you're just now starting out with your first baby. The other pro for having a home birth is that once everything is done and your baby's delivered, you don't ever have to go to the hospital again. You can stay home. Everything will be done for you at home. The midwife will check your baby, so you don't ever have to leave your home where you delivered. So you can have everything done for you. You don't have to leave to go anywhere with the baby if everything is normal, healthy, and well following the delivery. Okay, the other benefit is that all your appointments, normally when you've decided to have a home birth, will be done in your home. You don't have to leave to go to appointments in a in a clinic, in a hospital, in a children's center, or anything like this. The midwife will come home to you and do your antenatal assessments and everything like that at home for you. So it's really, really convenient. It's really beneficial. You get to know your midwife, and the other things that you will get to know your midwife that's going to deliver you, because they work as a team and they are called a home birth team. So you will get to know one or two who will always see you. They will caseload you, so you have just that one midwife or a second midwife, just because in case one is on annual leave or holidays, the other one can take over. So you will get to know its set of people who will be looking after you. Okay, so these are some of the pros for choosing to give birth at home. Now, of course, like I said, there's always a con to everything. So the cons to giving birth at home, the biggest one being the fact that you will not be able to have access to an epidural if you wanted an epidural. So you will have to be sent into the hospital if you wanted an epidural. So, of course, that's a big downside to it, for especially people that have in the back of their mind that they may want an epidural. But normally people that choose to have a home birth are really clear on this fact, and they are happy, and they are planning to not have an epidural. So it shouldn't be a problem, but it does come to it as well, where people might change their minds, or they will feel like, okay, they cannot cope anymore and they need to go in. So if you did have to go in for an epidural, then yes, you will have to then get dressed again, come out of your lovely cozy environment to go back into a delivery suite. The other con about having a birth at home is that if there was any issues with either you or the baby, you will have to be transferred in. It means you need to be taken in by an ambulance, or if anything, they may have to call an ambulance on standby. So that might be a bit of a worry for you, or for your partner, or your birthing partners, whoever is with you, if you had to be rushed into hospital for any emergency situation. So this is why it comes back to being, really risk assessed for home birth, to make sure that you are low risk enough and there isn't a high chance of you needing to be rushed into hospital for any reason. So you need to be really, really well risk assessed to make sure you are suitable for it. Another con that I can think about for having your baby at home is the fact that if you have to have a water birth, you have to get all the equipment yourself. So if you needed a water birth, unlike having it in a hospital, the pool will be there for you, but this time it will not be. So you will have to rent it or buy one, and that's another expense that you will have to spend on. So that's another con for some people. Another con for having a home birth could be that you may think your home may get messy. You might get blood spatters on some piece of furniture or carpet, or there could be a little bit of mess with water if you're having a water bath and things like that. Of course, the midwife will do their best diligence to clean up afterwards, to make sure they're not making any mess when they're looking after you and things like that. But of course, anything can happen, and accidents do happen, and things might spill over and things like that. So that's another con for having a home birth. So if you were thinking of having a home birth, please do discuss it with your care provider. Let them do a thorough risk assessment on you and your baby to make sure that you are really suitable for it, and therefore you are well, educated about what could happen, what are the risks, what are not, what are the benefits, what will happen if certain situation was to occur at home. Do ask all the questions. Another place where you can get information on is a website called Which. So it's www.which.co.uk, and you're just going to look for a study called the Birthplace Study. Okay, look for Birthplace Study. This is a great study which will help you in researching where is the best place for you to give birth. And it will give you a good insights into what your risks are of being transferred from home birth into the hospital. So I hope this information is useful for you. In the next video, I will be discussing about giving birth in a birth center and the pros and cons for those as well. So I hope you enjoyed this video, and if you did enjoy it, please subscribe to the channel, help me grow this channel, and I'll be bringing you more contents like this. Any subscribers that I get helps me, it motivates me to want to do more videos, to do more content, because I know people are watching it and people have subscribed, which means you are looking forward to the next video. So it helps me to want to make more video. So if you did like it, please give it a thumbs up, press the subscribe button, and also put on your notification bell. Of course, share this video with anybody else that you feel will benefit from this video, and tell them to subscribe as well, because like I said, there's 2 more parts to this, and I'll be making those and uploading them very soon. Thank you very much for watching this video. I hope you enjoyed it, found it useful, and I'll see you in the next one. Take care, guys. Bye bye.